Hi, my name is Dr. Lori Spuzak. I'm the Program Director for the University of Kansas Gynecologic Oncology Fellowship Program. We'd like to thank you for joining us for this year's interview season and welcome you to Kansas City and to our fellowship program. The University of Kansas Medical Center and Cancer Center is the only NCI designated cancer center in Kansas and surrounding areas. We represent all subspecialty services here, and we have state-of-the-art operating suites. The University of Kansas Cancer Center has a very vast catchment area, including all of Kansas and Nebraska, Iowa, many parts of Missouri, and Oklahoma. We see patients travel sometimes up to 400 miles to come and get care with us here at KU. On the right, you can see the other NCI designated cancer centers that are the closest in proximity to our center. Here you can see some of our case volume numbers prior to our application for fellowship in 2017. What you'll notice about these is that there is a high volume of all of the critical ovarian, endometrial, and cervical cancer cases that are required for advanced fellowship training. And additionally, we have a close collaborative relationship with colorectal surgery and urologic oncology, where we perform the majority of hysterectomy for their complex posterior, anterior exenteration cases as well. You'll be able to see some of the clinic spaces on the video, but also just to introduce, our outpatient clinic sites are at the Westwood Cancer Center, the Clinical Research Center, and the Women's Cancer Center at Indian Creek campus. We'd like to introduce our most important component of the program, and this is Norma Turner. She's the real boss of this place. Norma coordinates both the Gyn-Onc Fellowship and additionally the MFM Fellowship here at KU. Dr. Annie Jewell is our division director, and I am Dr. Lori Spuzak, the fellowship program director, and we are currently actively recruiting 2 further members of our division of gynecologic oncology. Here you are introduced to a number of our faculty members from other departments that actively work with our fellow trainees. Dr. Andy Hoover is our brachytherapy fellowship trained radiation oncologist. Dr. Robert Plenicky provides gynecologic oncology chemotherapy for our patients, in addition to myself and Dr. Jewell. Dr. Alkas Pools is our surgical oncologist that we collaborate with the most for our HIPEC procedures. Dr. Martin and Dr. Ashcraft are colorectal surgeons who we also collaborate with for complex GI surgery and upper abdominal GI surgery. And Dr. Weyer and Holtz-Berline collaborate with us for our anterior pelvic exenterative procedures or other complex reconstructive surgeries. Our program structure is in line with ABOG requirements for program length of a 3-year program, including 12 months of protected research and 24 months of clinical training. Additionally, ABOG requires curriculum in general colorectal, vascular, and urologic surgery, medical oncology, and radiotherapy. And you've met some of the faculty already who help us satisfy those curriculum requirements. Additionally, we abide by the leave of absence policies. For a 3-year program, leave must not exceed 8 weeks per year or 15 weeks over 3 years. Something that makes our program unique is our off-service rotations. Here you can see a schedule for our upcoming academic year. We have 1 month of SICU rotation, 2 months of inpatient and outpatient palliative care, 1 month of urology and colorectal surgery, 1 month of radiation oncology, and our outpatient clinic rotates monthly between the 3 attendings above, including myself, Dr. Jewell, and Dr. Plenicki. Some really important reasons to come to KU include our phase 1 clinical trial exposure with Dr. Jewell. You'll have the opportunity to rotate in her phase 1 clinic. The KU Cancer Center is the top recruiter for 2019 for NRG trials in the US, and the GYN phase 1 contribution is a huge part of this. The GYN recruitment for trials and the number of clinical trials since Dr. Jewell came to KU has increased by 500%. We were awarded an NCI P30 catch-up grant in 2020, and Dr. Jewell is a co-PI, and this gives rural patients access to clinical trials. Dr. Jewell is also a co-PI on an R01 we were just awarded in the last month for extracellular vesicle proteomic fingerprinting of ovarian cancer for early detection with a nano-engineered microsystem. Dr. Andy Godwin is the PI on this grant. Dr. Jewell is also the author of an investigator-initiated trial, a HIPEC trial, and there are many opportunities for translational research in gynecologic malignancies here at KU. Another reason to come to KU is our extensive training in inpatient and outpatient palliative care. I have dual fellowship training in gynecologic oncology and hospice and palliative medicine, and HPM therefore is integrated into our program extensively. I will be taking the Vital Talk the trainer curriculum for mastering difficult conversations. And by 2022, we will be having in-person communication trainings for our fellows. And additionally, I'm always working on research in palliative care and oncology education and integration. And so if you are interested in those types of research opportunities, you should really consider this program. Another unique program highlight is the Woman to Woman program at the University of Kansas Health System, a program of the Ovarian Cancer Research Alliance. If you click on this link, it'll take you to our webpage at the Cancer Center, and also you can watch a bench to bedside video where we're interviewed, and some of our mentor and mentee matches are interviewed about their experience participating in the Woman to Woman program. Not only are we administering this peer mentorship program, but additionally, I and a research group are working on several projects about peer support and peer education and media development. So if you're interested in this type of research, this is another big opportunity here at KU. The salary for our fellows is standardized and benchmarked to the AAMC Midwest region median salary. If you're not already board certified for general OBGYN, we would expect that you take the general oral boards during fellowship. We cannot pay for boards, but we will support time for test and preparation. Additionally, we will support the attendance of at least one conference per year. And additionally, you might apply for funds through our Chairs Fund if you have research accepted to other conferences and have invited presentations to other conferences throughout the year. We are working hard to promote a culture of diversity and inclusion here at the University of Kansas and within our Gynecologic Oncology Division and Fellowship. The University of Kansas appointed a Vice Chancellor of Diversity, Equity, Inclusion, Dr. Geraldine McGee. And since the Vice Chancellor was appointed, and with the support of Dean Ojo, KUMC has been actively assessing its current climate to improve conditions and provide resources for recruitment, retention, and promotion of underrepresented minorities. We have been working amid the COVID-19 pandemic and Black Lives Matter movement to actively respond to calls for examination and action to address systemic racism throughout our institution, including in our Department of Obstetrics and Gynecology and in the Gynecologic Oncology Fellowship. I am also happy to share that the KU School of Medicine GME office has put forth an anti-discrimination statement as follows. Importantly, we are committed to the following actions and work in the KU School of Medicine GME. Partnering with the University of Kansas Medical Center's Office for Diversity, Equity, and Inclusion and the School of Medicine's Office of Diversity and Inclusion to align policies, processes, and strategies. We are fostering diversity, equity, and inclusion in our policies, programs, recruitment, practices, and retention. We are investigating biases and systemic advantages and oppression. We are developing and implementing strategies, policies, resources, and processes that promote diversity, equity, inclusion, and a sense of belonging. We are eliminating systematic advantages and oppression. The work necessary to drive change and make meaningful improvement begins with intentional actions and sufficient resources. And the Gynecologic Oncology Fellowship Program is in line with the GME goals and anti-discrimination statement. Additionally, the University of Kansas Hospital is rated as a leader in LGBTQ healthcare equality by the Human Rights Campaign based on the Healthcare Equality Index. The Department of Obstetrics and Gynecology has a transgender health clinic led by Dr. Meredith Gray of OBGYN, Dr. Satish Panuru of plastic surgery, and Dr. Josh Brogemer of urology. We're really excited to brag about our first two fellows and all of their accomplishments. Dr. Shariska Peterson and Dr. Chelsea Salyer are setting a high bar for all of the rest of the fellows who will join us here at KU. But they're a great example of the opportunities that we have here and what you can accomplish if you have a strong sense of research and what you want to accomplish during fellowship. In 1 year, I was able to modify this slide from grants and awards and oral and poster presentations to this giant list of publications of Dr. Peterson's research during fellowship. She has been awarded a number of grants and awards for her research, and additionally has been very prolific in publications since she's been here, both in bench and also in big data research. And additionally, her quality improvement work is now being presented in the poster below and will be turned into a publication soon in the future. Dr. Salyer's research since being a fellow and her grant awards also speak to the number of opportunities in population health, in genetics, in a number of different departments across the Cancer Center. What we have is an abundance of mentors, and we are happy to facilitate introductions and collaborations across disciplines for whatever you are coming to KU with an interest in. We ask that you participate in some advanced coursework regarding statistics and data management and potentially tumor development and progression depending on where your research interests lie. And we will have you either audit coursework or you may apply for the Master's in Clinical Research program. However, it's no longer funded by the Department of Obstetrics and Gynecology. If you are awarded a grant or pay for the program, you may apply. Other details of our program include our call schedule. It's at-home call 1 and 3. We have typical standard holidays. The AC, GME, ABOG, and GME vacation and sick time is consistent. It's 15 vacation days per year and 10 days of sick days per year. The salary is in line with the typical AAMC median salary for the region, and we do support board certification for time and a small stipend for preparation. Because our programs in Gynonc and MFM are small, we want our fellows to have a sense of community. COVID made that really hard, but we really tried to work on collaboration and community building within the Gynonc and MFM fellowship program. So we supported a fellows retreat in 2020 and want to make this an annual experience for our fellows. Additionally, we created an interprofessional fellows workroom with a lounge for the Gynonc and MFM fellows to have a collegial space. We have started professional coaching during the first clinical year, and this will continue with Dr. Carrie Thurman, who is a urologist and coach. She is currently working in Colorado. She used to be a faculty member here at the University of Kansas, but will continue working on developing our professional development and coaching program with us at the Gynonc Fellowship here at KU. And additionally, the KUMC Fellows have access to the Counseling and Educational Support Center, and counseling may be provided without cost or on a sliding fee basis, and all services are confidential. When COVID is not locking us down, Kansas City is really an incredible place to live and be. Well, it takes 15 minutes for me to drive from my house to downtown, and I have access to a world-class opera and symphony, world-class sports teams who were national heroes just 2 years ago, beautiful natural resources both in Kansas and in Missouri, and world-class art, which is an incredible thing for a mid-sized city in this country to have access to all of these things. Again, thank you for considering our program. We're really excited to interview you and answer all your questions, and hopefully this gave you a little bit of a remote introduction to our medical center and to our fellowship program, and we look forward to meeting you.